Radewagen, you're recognized.
Thank you, Mr. Chairman. I, too, want to welcome you both and thank you for your leadership and service. Ms. Schlichting, in my home district, American Samoa, over 60% of the veterans have to travel off-island at a minimum of 5 hours by air for medical appointments. In the Commission's final report as part of the Commissioner's site visit observations, the report cites poor access to VA care for rural veterans as one of the major weaknesses of the VA. For instance, in American Samoa, the hospital is in such need of upgrades to facilities and equipment, as well as being short-staffed, that the VA drastically limits the use of the hospital for VA health care. Were the U.S. insular areas included in this evaluation as part of the underserved and/or rural areas? And would you please highlight which of the Commission's recommendations aim to address these underserved areas, especially those you think would apply to the U.S. insular territories?
We did pay a lot of attention to the issues of rural access and really thinking about how to provide improved access. This was one of the reasons we thought it was so critical to really look at a more integrated model of care, because in many parts of our country and beyond, we have situations where veterans simply cannot get the access they need locally through the VA, but in fact are using, in some cases, private health care, but perhaps not organizing it as well. And the organization is actually very critical to the outcomes of care coordination, and making sure people have the kind of providers that they need. So what we recommended was this integrated model of creating one system so that in every part of where veterans live and work, that they have access to what they need in a way that really enhances their outcomes.
Thank you, Mr. Chairman. I yield back.